The video you are about to watch is brought to you by the Sinus Therapeutic Laser Centers of Delray Community Hospital and West Boca Medical Center. Dr. Daniel Schumann, Medical Director of the Sinus Therapeutic Laser Centers, will be providing a brief overview of the concept of aqua laser endoscopic sinus procedures. He is one of the many laser physicians affiliated with this multidisciplinary program. If you would like more information, please contact us at the number listed at the end of this video. Thank you for taking the time to learn more about this unique one-day laser sinus treatment.
These pictures show what can happen if polyps are left untreated. These severe cases required severe surgery and long recovery times.
The typical patient may be suffering from a variety of symptoms, including headaches, snoring, nasal obstruction with or without drainage, obstructive sleep apnea, persistent or recurring tonsillitis and/or sore throat, especially in adults, obstructive nasal polyps, loss of smell or taste, dependence on over-the-counter nasal sprays, history of recurrent sinus infections, recurrent head colds, chronic cough, postnasal drainage, hoarseness, recurrent nasal bleeding of unknown etiologies, deviated or fractured septal structures, facial pain and swelling, and persistent symptoms in the nasal area in spite of allergy and other nasal treatments.
And now, 7 Healthcast with Marilyn Mitchell.
New help for people with sinus problems. Suffer from serious sinus problems. There's a new procedure that may offer you relief without pain. It's called aqua laser surgery. Health reporter Robin Meade tells us it is like washing the problem away.
Use the water.
You wash your face with it every morning, and now it is part of the solution for this man's chronic sinus problems. Water coupled with a surgical laser.
He's filled, as you can see, the frontal sinus here. He's ready to explode.
Diseased tissue, blockages, and cysts in the sinuses. Teresa Vignal went through the same thing.
I started off with ear infections, and I couldn't get rid of them. I was taking antibiotics, and I would get them every few weeks.
Most of the time, the answer for sinus-related problems is cutting, burning, and ripping away the bad tissue inside the cavity with a laser.
But now doctors find if they flow saline through the sinuses and warm it with the heat of a laser, the bad tissue breaks up by itself and flows away.
You know, in the beginning, we couldn't go in here. I don't know if you remember that. You couldn't see anything. It was all swollen.
Dr. Daniel Schumann in the West Boca Medical Center helped develop this procedure. He says it means less pain and a shortened recovery for the patient.
Essentially, because there's no cutting, you're using water as a surgical tool. And the warm water is very gentle. It's very soothing.
The aqua laser can be used on a number of sinus problems like nasal spurs, sleep apnea, sinus headaches, and allergic headaches. For many people, like Teresa, it means a literal sigh of relief.
And now I don't snore. My husband can sleep at night, and it's made a big difference.
Robin Meade said.
I'm Daniel M. Schumann. I'm one of the surgeons involved with the Sinus Therapeutic Laser Centers of Delray Community Hospital and West Boca Medical Center. One of the co-directors, I and Dr. Robert Pinheiro, both were trained at Johns Hopkins Hospital and were instructors and professors there up to 1983. Since the functional endoscopic procedure was started at Johns Hopkins Hospital in this country, it was there that we basically were able to obtain some of our experiences and have developed it ever since down here in the South Florida area. We have over 8 years' experience and over thousands of cases that have been done during that period of time. My background in particular is related to endoscopic and head and neck cancer work with the use for hemophiliacs and people with bleeding disorders where the application of laser was most welcomed. As a medical professional, you realize the benefits of laser procedures, especially today in the head and neck area. They include the following: less blood loss, and because of less blood loss, less likely to have a transfusion. This is also to the less need for packing, which means less pain, less scarring, less anesthesia, and less risk of complications, less risk of infection, and less need for pain-relieving drugs postoperatively, less time away from patients' work, and less time in the hospital. These benefits from aqua laser endoscopic sinus procedures certainly outweigh those from previous radical external surgeries of the sinuses, such as the Colwell operation, first instituted in 1893. These procedures are done on an outpatient basis either at Delray Community Hospital or West Boca Medical Center, and are covered by most insurances. We would also like to express our willingness to review and to consult on any sinus films on any particular patient you may have. We also express our willingness to teach other physicians, as we have established a preceptorship program, both for physicians in the United States and those abroad, who come for a week preceptorship under the guidance of the Sinus Therapeutic Laser Centers, as well as national courses that are given at Delray Community Hospital and West Boca Medical Center over the next 2 years on a twice-a-year basis. We look forward to seeing you in the near future.
We are currently marketing the Sinus Therapeutic Laser Centers to the general public. Patient health questionnaires and brochures are available, and inquiries are being handled by our telemarketing staff. Our offices are conveniently located in South Palm Beach County and are very accessible from I-95, Florida's Turnpike, and all other major roadways. If you would like more information about the Sinus Therapeutic Laser Centers of Delray Community Hospital and West Boca Medical Center, please contact us at 1-800-2-SINUS-1.
With you now, 2 such patients who underwent laser endoscopic safe sinus surgery. Pediatric patient presented with 2 episodes of proptosis with major infections involving the orbit of the eye, without, thank God, any meningenic involvement. The patient had been on months of antibiotic use, as well as IV antibiotics through hospitalization with very little relief. The patient presented, therefore, with, as you can see through his CAT scans, extensive disease involving the underlying maxillary and ethmoid sinuses. Removal of the diseased tissue began that morning with the use of the modified functional endoscopic sinus approach and the use of a sapphire tip aqua laser. The patient required no packing and no application beyond simple gel film, which is an absorbable material like Saran wrap, placed within the sinus cavities, and the patient was seen in the office within 18 to 24 hours, with a smile on his face, not requiring any other therapeutic treatment. Allow me to give you a brief overview. We look forward to seeing you in the near future.